Hello, good afternoon. Thank you everyone for joining me today over your lunch hour. I do appreciate it and will use your time as efficiently as possible. Most of you know me. My name is Charisse. I'm a nurse practitioner since 1999, with those years being in internal medicine. I've been practicing functional medicine since 2016 and completed my fellowship in functional medicine 2018, the end of 2018. It is a passion of mine. It's a passion of my husband. My husband is Steve. I own Central Drug with him. He's the skinny guy with the white hair on that picture. Today, I'm going to be talking about Men's Health 101, and it's a personal topic for me. Steve was diagnosed with prostate cancer last year. Could we have caught it sooner if we would have been on our game about screening PSA blood test? You betcha. So again, this talk has personal meaning to me as well, because we have a story of our own that I'd love to sit down and share with you sometimes. At any rate, we're going to talk about Men's Health 101. Let's get started. We're going to cover preventative screening exams and why you guys don't do them. Bottom line, men go to the doctor, the provider, less often than women. Why is that? The bottom line is men live less years, fewer years than women, and we think it's attributable to this. We don't catch things early on guys because they don't get to their healthcare provider's office. Why is that? For many of them, it is fear. You can admit it, guys. They did a survey, 20% of all men, they fear going to the provider, and the main fear is they're scared to get a bad diagnosis. So they just flat out don't go. They don't get regular checkups. There's a machismo attitude. I'm a big tough guy. I'm great. I'm doing fine. Why do I need to go to my provider, my physician's office? And then there's discomfort. They're worried about the lovely old digital rectal exam, DRE. We don't do those as frequently, guys, anymore. But at any rate, so that's another reason they put off at of going to their yearly visits and getting screening exams. And it's not working out for them. Again, they die sooner than us females. An ounce of prevention, it's worth it. Look at those stats. 3 out of 5 guys, only 3 of them get their yearly checkup. 12% of all men over the measly age of 18, they are in poor to fair health. Again, 40% of guys only go to the doctor when they really, really think something is wrong with them, a chronic medical condition. And then the obesity epidemic here, especially in South Texas, Americans as a whole, up to 75% of all Americans, women and men, are overweight or obese. That is tragic. We now have more than 40% of the American population that are obese. We have to do something about it. This is a huge cardiometabolic crisis that we have in our country. Annual healthcare checkups help detect heart disease, cancer. There's counseling, there's tips, there's lifestyle things we can do about being overweight and obese. You've got to get to the doctor's office. Screenings are available for blood pressure, for your cardiovascular health, cancer, prostate cancer, bladder cancer, colon cancer. You've got to get there. So let's talk about heart disease. 1 out of every 4 males, they die because of heart disease. That's a pretty good statistic. There's high blood pressure, there's LDL lousy cholesterol that can be screened for, smoking. Those are all key risk factors for heart disease. And according to the Center of Disease Control, about half of all Americans have at least one of those 3 risk factors. Additional factors for men that increase their risk of heart disease is obesity, being overweight, diabetes, shift work, poor sleep, stress, excessive alcohol use. All of these things are preventable. Prostate cancer, again, our personal favorite / unfavorite with Steve. You need to get your annual blood exams. 50% of all men over the measly young age of 50 have something called PIN, prostatic intraepithelial neoplasia. Those are little bitty microscopic changes that happen in the benign prostate healthy cells. High-grade PIN is considered a precursor to prostate cancer. What do you do for screening? You do blood tests. That's not a digital rectal exam, guys. So go get your blood drawn, see your provider, get that lab work order, and go get it done. Blood test screening for prostate cancer should start at the age of 55. However, if you have a first degree relative, like my husband does, you should start getting screened at the age of 45. If you have two second degree relatives, like an uncle, a cousin that have prostate cancer, you need to get screened at age 45. The rest of you guys, 55 for sure. Again, what's your risk for this disease? Being older than 50, eating a lot of high fat red meat, lots of dairy, being obese, exposure to Agent Orange, and again, that yucky old family history. Colorectal cancer. Cancer is the second leading, or cancer itself is the second leading cause of death in America. Of that cancer category, colorectal cancer places second to lung cancer. So it's the second most common cause of cancer deaths. The American Cancer Society, this is different than when I was in internal medicine 20 years ago. The ACS now recommends colorectal cancer screening to begin at the age of 45, not 50, but 45. Either a bowel movement stool testing for blood, you guys have heard of Cologuard, or a colonoscopy. Okay, one of those two things needs to start at age 45. So when do we stop that screening? Some people will say, well, my doctor said I didn't have to have that done anymore. You should be colon cancer screened or have a colonoscopy. If it comes back normal at age 45, then they go to every 10 years if you don't have a family history. If you are vibrant at age 75, we do not stop colon cancer screening. So that's a misunderstanding. What is the person's life expectancy? It all comes down to looking at the person as an individual. If someone is frail, they've already broken a hip, they've had bypass surgery, 4 vessels, they're congestive heart failure, maybe we don't screen that guy at age 80, at age 75. The bottom line is ages 76 through 85, it's individual. It's an individual decision based on a discussion with your provider. How vibrant are you? Bottom line, people over the age of 85 no longer need colorectal cancer screening. Melanoma. This is the one that kills you. Older men are twice as likely to develop melanoma than women. And by age 80, men are 3 times more likely than women in that age group to develop melanoma, and it will kill you. Men are also 2 to 3 times more likely to get the other 2 skin cancers, squamous cell cancer, basal cell cancer. Why is this? Once again, why do men have more risk with skin cancer? Well, duh. Number 1, they don't go to their provider. Number 2, the machismo factor again. They don't wear sunscreen. That's lady stuff who don't want to get wrinkles. We don't need to use sunscreen. So they don't get screened. They don't wear sunscreen. It's also thought that men, their skin is thicker. They have a less fatty layer underneath, so they don't have the protection. So that makes their skin to be more likely damaged by the sun's ultraviolet rays. Again, melanoma is the most serious type of skin cancer. Early detection, once again, is the key to treatment. Blood pressure. Pay very special attention to this chart. It's a lot different than what I hear my patients telling me when they come in, and I get their blood pressure at 136/88. They think that's great. And I have to gently explain to them in my practice, a diagnosis of high blood pressure is a systolic value, that's the top value, greater than 130, and a bottom value, that's called the diastolic blood pressure, greater than 80. That's a lot stricter than it was 20 years ago when I first started in internal medicine. Half of all Americans have high blood pressure by that definition, greater than 130, greater than 80. But only 1 in 4 adults, 24%, only 1 in 4 of adults that have the diagnosis of high blood pressure actually have their blood pressure under optimal control. That means they're resistant to taking a second medication. We providers are not doing a good enough job educating you guys. Hey, these are the numbers. I have to get you there so there is not damage going on in your microvascular system, the teeny tiny blood vessels that feed our eyes, that feed our kidneys. It's unseen damage that gets us with high blood pressure, because that diagnosis can be present for years before treatment. It is the silent damager. So that too is why you've got to get yourself to the doctor's office, because you have to be screened for that. And I like a manual blood pressure. I don't like a wrist cuff or an automatic cuff. The internist I trained with, he taught me the appropriate way to check blood pressure is a manual blood pressure check. Factors leading to high blood pressure: family history, high salt diet, excess alcohol, and then the crisis we've already talked about, overweight, being obese. Huge in the United States of America. Lack of activity or movement. So what about cholesterol? You guys have heard of these before, so I don't need to touch in depth. LDL, lousy cholesterol, that's the cholesterol that likes to contribute to plaque buildup. HDL is our healthy, happy cholesterol. I like to call it my vacuum cleaner cholesterol that helps mitigate that risk from plaque buildup. Plaque buildup in our blood vessels reduces the oxygen supply to the heart. And when that plaque erupts, that's what leads to a heart attack or an event. Again, HDL is healthy, happy cholesterol. LDL is lousy cholesterol. That's all you need to remember. I do a talk more in depth on cholesterol and LDL particle size. That's a little too in depth for this talk. Just know you need to get your cholesterol screened. Okay, risk factors for high cholesterol. Again, saturated fats, trans fats, processed foods, simple carbohydrates. People don't think of sugar equating to lousy cholesterol, but it does. Processed foods, lack of exercise, being overweight and obese. Type 2 diabetes. So here's what's crazy. We're supposed to start screening for cholesterol at age 35, but the American Diabetic Association doesn't recommend starting to screen for diabetes if you really don't present with risk factors until the whopping age of 45. I find that insufficient for our practice here in South Texas, which is the cardiometabolic, diabetes, overweight, obesity disaster of the world. People need to be screened sooner than that. And we providers need to educate you guys that you need to come in and get your blood sugar drawn. Men develop diabetes more often than women do. There's about 14% of all men in America that have type 2 diabetes, about 11% of women. There are buckets and bucket loads more of people that have pre-diabetes or insulin resistance. And that's where we providers need to catch you, because we can make a difference and we can reverse pre-diabetes. This is a lifestyle problem. What are some signs that your blood sugar may be elevated? Inability to sustain an erection, overactive bladder, blurry vision, being able to hold your urine, incontinence, being thirsty, having a dry mouth. Again, the American Cancer Society recommends screening every 3 years, which to me is kind of crazy, starting at the age of 45. We providers have to be astute enough to pick up on risk factors like being overweight. There are so many people that we don't think they're overweight, but when you chart them based on their height and their weight together and get their body mass index, their BMI, they need to be screened. So we're responsible for identifying those multiple risk factors and getting a blood sugar check. We do a fasting blood glucose with lab to screen for diabetes. Glaucoma. I always learn something when I'm putting together these slides. I knew glaucoma is a disease where the optic nerve, due to pressure and fluid buildup behind the eye, so pressure increases and pressure increases, and that pressure is exerted on the optic nerve. This can lead to blindness. Usually there's no early symptoms. Only an eye doctor, an ophthalmologist, an optometrist can diagnose glaucoma. This is why we need to go to the eye doctor routinely. Under the age of 40, we need to be seeing the eye doctor every 2 to 4 years. From 40 to 54, about every age 1 to 2 years. Once we're over the age of 60, or age 55 to 64 is 1 to 2 years. Over the age of 65, definitely yearly. That's a yearly trip to the eye doctor, perhaps even every 6 months, because this is something that needs to be caught early. So this is my slide that kind of provides a summary of screening exams for men. This slide is Men's Health 101. Talks about annual screenings over there to the left, prostate cancer 50, earlier if there's a family history, same thing, colorectal cancer, yearly checks for skin cancer, high blood pressure, and cholesterol. Then there's that very weird square in the middle that I disagree with, because I practice in South Texas, so does Steve. Diabetes screening beginning at age 45, check your blood sugar every 3 years. That's ridiculous. So I look at it more often, because we can make a difference when we catch somebody that's insulin resistant, pre-diabetic. And then there's the part on glaucoma screening. So keep this slide in mind, and I can send slides out to you upon your request. The hint on the other slide was, where was the goodness almighty T? The almighty testosterone. That's our primary sex hormone in men. We women have testosterone as well, but obviously a lot lesser amount. There is no recommendation for screening testosterone. That's why it doesn't get done. There's no society that tells Sharice or Steve, recommend to your patients at age 45 to begin getting testosterone checked. The patient, and you guys don't complain, males don't complain, they don't even talk much when they're in the provider's office. I can vouch for that. We have to look for signs as clinicians. I don't feel like playing ball with the guys as much as I used to. I'm not as interested in my wife as I used to be. I'm anxious, I'm unsettled, I'm not sleeping as well. I'm getting this paunch around my middle and I can't lose it, even though I kind of am going walking, I'm kind of working out. I'm on shift work. My sleep is lousy. I'm fatigued. My cholesterol is lousy, or my sugar is lousy. It's a travesty if I, Sharice, a nurse practitioner, have a patient who's 45 and they're pre-diabetic and I don't check a testosterone. I'm interested in optimizing testosterone, not so you look like this ridiculous bodybuilder that's on this slide, but because I can make a difference in inflammation if I get a gentleman's testosterone up to a reasonable level. I can't tell you how many young men, because of environmental exposure, xenoestrogens, plastics, phthalate exposure, again, lousy sleep, stress, processed food, their testosterone, I have 30-year-olds in my practice, their testosterone is 100, okay? Normal testosterone is 300 nanograms per milliliter. You have to talk about some of the things you're experiencing so we can get you screened, okay? Muscle loss, again, your arms are skinnier, but your waistline is bigger. That's a problem. That's a screening for testosterone levels, blinking light for Sharice and Steve. So to summarize lifestyle factors, all of these we can make a difference with these. Smoking, alcohol excess, what do these things all have in common? They are all preventable. We can mitigate risk if we catch them early. Just to mention, motor vehicle accidents are higher in men, so is depression and suicide. Once again, you guys don't talk. Please reach out. You have to tell your provider if you're feeling despondent, if you're feeling blue. And who has not felt that way with coronavirus and politics the way it has been the last 2 years? Now we're all concerned about the economy. You have to give yourself permission to talk about these things so we can help you with strategies to change poor habits and lower those risks of the diseases that I ran through so quickly. These are all things that we can have tremendous impact upon. So just briefly to fly through some of those recommendations, you know these things already. You probably just need help. I always tell our patients, you're the bus driver. You have to tell us your comfort level with speed and your steering mechanism. We are the person in the seat right behind you. Our hand is on your shoulder. We are here to help and find something that's manageable and doable for you. Men are more likely to be overweight than women. Women beat men at obesity a little bit much, by just a little bit. Bottom line again, 74-75% of all Americans, men or women, are overweight. Then there's that obese guy here in the picture. There now, Americans, men and women combined, we are topping that 40% mark on obesity. This is a huge crisis. Whole foods, minimize processed foods, eat the rainbow, more veggies, more whole grains, get rid of bacon. You get bacon once a week, you get red meat once a week. That's a conversation, a more in-depth consult that we can talk to you about what's manageable. Obviously, added sugar, white flour, processed oils, trans fats, fast foods, we need to minimize these. We have to get moving. No, not every one of us can go train for a half marathon. I don't advise it in a lot of my patients. However, we do have to get moving. Park your car farther from the grocery store. Carry your groceries. Carry your golf bag. Take the stairs instead of the elevator. The United States Department of Health and Human Services recommend 150 minutes per week of aerobic physical activity. And that's 2 hours, 30 minutes total. That can be 50 minutes, 3 days a week. That can be 30 minutes, 5 days a week. Drinking alcohol, that has to be done in moderation. For some of us, it's a no-no if we have a family history of addiction, sex, drugs, rock and roll, smoking, and being, all or nothing mentality. So some of us have to be very, very careful with our alcohol intake. Again, men over the age of 65, definitely no more than 1 drink a day. For men less than 65, 2 is max. It's better if it's none at all. The American Cancer Society last year began to include alcohol on its risk factor list for prostate cancer and breast cancer. That is sombering news that I have to share with my patients, and I tell them that every day. I also tell them, Steve and I, we don't like to eat kale and drink water and watch our wine or alcohol consumption, but it is something that we do to mitigate risk. Alcohol use has been linked to more cancers than just liver cancer. Alcohol use is linked to colorectal cancer, again, prostate cancer. Smoking's linked to bladder cancer, not just lung cancer. Again, it's kind of fun, or it's kind of not fun, everything in moderation. Alcohol, that moderation line is getting lower and lower and lower. Again, too much alcohol can raise your blood pressure. Stress, that's a tough one. Even if you win the lottery, we have familial stressors. We worry about our kiddos. I guess if we won the lotto, we wouldn't have to worry about our job, but stress causes inflammation. It decreases our immune resilience. It impacts our gut health, which is tied. Gut health is imperative to immune resilience. So we talk about ways with our patients to mitigate stress. 20 minutes quiet time of brain time. It's not being selfish to limit your children's time, your wife's time, your girlfriend's time to your ear for 20 minutes a day. Do something quiet. That's when you can go on a walk and combine the movement with stress relief. Meditation. You macho guys will laugh at that, but it is very, very powerful. You hear about these things with the superstars of the athletics, the Tom Brady's of the world. Look at his diet. He meditates. He stretches. He's vegan. So these are all very different concepts than 10 years ago, but we have to look out for stress. Stress is also linked to anxiety and depression. And remember, men have more suicide and depression than women. Daily breathing exercises. The quit smoking, that's a no-brainer. I don't have to yap to you about that. You all know that by now. So here's my case study. Briefly, it's not just the 63-year-old executive who's obese that has lower testosterone. So Sharice and Steve do have a 32-year-old gentleman that came to us in our practice. He's an outdoorsy kind of guy. He likes to fish. He does work around chemicals. Came to me, and obviously the primary complaint was my erections. He didn't really mention not being interested in sex, but his erections were not what they once were at the tender age of 32, right? That's a baby by my standards these days. It wasn't one thing. We had to look at a number of things. This gentleman, his thyroid was not optimized. We worked on optimizing his thyroid. We worked on quality sleep. 4 hours a night when you're running your own small business and you're raising kiddos, you cannot exist on 4 hours of sleep. And it was impacting him, to say the least. We worked on his diet. He was 5'10". big guy of 215. Well, here's the bad news. That's being obese. You're eating too much red meat. Let me talk to you. Let Steve talk to you. What can we do with your food plan? What can we do with some sustained aerobic activity? A little zinc, um, proper nutrition, supplementing with a pharmaceutical grade multivitamin, getting your gut health in order. Um, Again, optimizing his thyroid, we've been able to get his testosterone up without prescribing his testosterone. So you don't always fix low testosterone with testosterone replacement. In fact, I definitely advise against it in someone at the tender age of 32. But the bottom line for you to take with you from this talk is this gentleman had multiple lifestyle factors that were preventable, were changeable. He was the guy in control. We just had to give him his control back and do a little bit of education to get him feeling better. We also talked to him, obviously, just as an aside, about detox because of him working with various chemicals. At any rate, it was a very rewarding experience. I mainly want to take, for you to take from this talk is it's not necessarily the 60-year-old gentleman, bank executive with tons of stress. So a lot of information in a short amount of time. I did have one question beforehand. Somebody had sent me, they want the recording of this talk. We will be sending the recording and the slides out afterwards if anyone expresses interest and they weren't able to make it today. The questions I had somebody ask, does Cherie see men in her practice? They asked if I can come visit with me. It was one of my beautiful friends from when I practiced in Port Lavaca in internal medicine. Again, he saw a social media post. So what a blessing. I'm going to get to visit with him in a consultation over in my practice. Again, as an aside, Steve sees folks as consults every day in the pharmacy to tweak sleep, to tweak bowel movement, gut health, to work on stress. So I would encourage you to reach out for us. We want to reach out to us. We want to be a resource for you. We know we can be a huge impact in your life. Sometimes it just takes a little tweak here, a little tweak there, and you need the health support, advice, and guidance as seen in this slide. So please send me any questions. Let me check the chat. A lot of times folks are shy, but I will check the chat nonetheless. I did put in the chat our phone numbers, and I did put these discovery call links and pharmacy consult links to make it easy for you to reach out. We'd appreciate it if you did that. Thank you so much, and I'm going to wait if there's any questions. I always have a quiet crowd. I think everyone's focused on their lunch and kind of quietly munching with their audio turned off, but that's okay. You know where to find us. Ah, I do have a question. Yes, microwaving in plastics, what you hear about BPA and phthalates, yes, that is true. That can impact our hormonal health. Again, you remember that last slide when we talked about this gentleman, and I didn't emphasize it enough, an important part of his treatment plan, because he worked around chemicals, was to incorporate a liver detox program. We did that to begin. We'll probably do that about every 4 months with him, and to look at household, what we call xenoestrogen exposure, things like microwaving in Tupperware. Don't do that. Steve and I had to change that aspect of our life when we finally got smart enough to 2 or 3 years ago. Don't drink water out of plastic water bottles. Not only is it lousy for our environment and the future environment for our kiddos, but it's just lousy for us. Again, that's more plastic exposure. So hopefully that answers your question. Any other questions? I just had somebody join Any questions? We were wrapping it up, and I will let you know. We will, just to let you know who just entered, because I did run through things pretty quickly today, that we will send a recording out for folks who are interested, and we can send the slide deck out. Please reach out to Steve and I. Again, we love people coming to visit us. We have a great time here at the pharmacy, putting people in charge, okay? You guys are the bus drivers, and you can make a tremendous impact on your health when we kind of devise a treatment plan so it's not overwhelming. What do I focus on first? Probably sleep. If your sleep is not quality, it's not 7 to 8 hours a night, game over. We have to have quality sleep. We have to mitigate some stress. So there are many little things that we can do some tweaks on to make you more vibrant and feel better. And we will also harass you and remind you of those age dates and those screening exams. And we may even suggest or send a note to your provider. If it's a pharmacy consult, we send notes to providers like, hey, John Smith, he's 52. It looks like this guy is putzing around and hadn't talked to you about getting his colonoscopy scheduled. So warning, we do tattle on you sometimes, but trust me, we want to catch things early so we can help you, because so many things are preventable. Any other questions? Okay. Very blessed on a Thursday. Thank you for all of your support on behalf of Central Drug. Thank you for your support on behalf of Sharice's Wellness Balance U functional medicine practice. Love you guys. Thanks so much, and have a good day.